And with that, let me say hello to everybody, all of our NatureBridge friends from across the country. And in fact, I think we've got a few people internationally joining us. And what I've asked people to do to get used to this Zoom technology is down at the bottom of your screen, there's a chat button, and you can go ahead and put in a place where you have had some outdoor peace, recreation, escape. It could be your patio, it could be a neighborhood park, it can be a national park if you're lucky enough to live near there. But you can go through that chat window on the bottom of the screen and get a sense of where people are coming in from. We're going to start our actual program at 6:05. Until then, I'm going to try and welcome everybody. My name is Phil Kilbridge. I am NatureBridge's president and CEO, and welcome to our Campfire chat featuring Dr. Steve Lockhart, who we'll hear from an interview I did with him earlier, but also we'll have a live Q&A in a little bit. So we've got people coming in from Pasadena, California and Maryland. We've got a lot of Californians, a lot of people from Seattle. Wow, some people are very lucky. They're on Bainbridge Island in Washington, the C&O Canal. Tom, I'm glad that you're getting out there from your home right near DC in Maryland. A lot of people from Marin, Birds of Prey Sanctuary, Nampa, Idaho. We've got, oh, hello, Carolee. Nice to have you on from our friends at Clean Canteen. So folks, we're still waiting for a lot of participants to join us. In the meantime, I'm gonna orient you to a few things for our Campfire chat. Again, at the bottom of the screen, you can use that chat window and you can put in a place where you are finding some solace and recreation in the outdoors during this epic pandemic, but you can also put in where that is so we know where folks are coming in from. The other thing is you do see an icon at the bottom of the screen, a Q&A. That's where I'd like you to start queuing up the questions that you would like to ask of Dr. Steve Lockhart. I'm going to try and cultivate those and curate those and then ask him live starting at about 6:30 p.m. When he joins us live, even though Steve is on and can see your chat. So please don't say anything nasty or inappropriate. We do not want to scare our VIP guest. Again, my name is Phil Kilbridge. I'm NatureBridge's president and CEO, and thank you for joining us for our Campfire chat. I do recognize that not everybody is joining via video. There are a number of people who are phoning in. So my apologies that you don't get to see the charming Steve Lockhart. You won't get to see the photos of some of our amazing student participants, and you won't be able to participate in the polls, but you will get to hear and be educated and be edified throughout this evening's gathering. For those just joining, we're going to start with the program in about 90 seconds. You can go to the chat button at the bottom of the screen, open that up, and you're going to get a sense on where people are finding peace and recreation, solitude during this time of lockdown, during this time of social distancing. We'd love for you to put in the name of the location. Great, we got some folks from St. Louis. Hello, Joni and Drew. It's nice to have my in-laws. My sound keeps dropping out, so I'm going to see if I need to be a little bit closer to the screen. And by the way, when you put in the chat, many people are chatting just to the panelists. You need to put to all panelists and attendees so everybody can see it. So for those of you who may be a little bit new to Zoom or who may just want to be sending it to me, know that you can send it to all panelists and attendees. So again, the chat window and then the Q&A is where we're going to start typing in the questions that we'd like to ask of Dr. Steve Lockhart. So we're already seeing questions from Jake and Denise Schultz. We're seeing a question from Ian Yallis. Thank you both for doing that. And Steve, you can get a sense by going there on what the questions are that people want to grill you with. Let me tell you what the agenda is going to be for tonight, just so you know what to expect. First of all, I'm going to be doing a little bit of a welcome. Then we are going to be joined by one of our former students of the year. You're going to be able to hear from our friend Selma Ruiz. I'll tell you a little bit more about her. That's when we'll go into the conversation I had earlier with Dr. Steve Lockhart From that, we will transition to the live Q&A. So again, you can go to the Q&A at the bottom of the screen and type in questions that you'd like us to queue up for Dr. Steve Lockhart. And with that said, why don't we go ahead and start the evening? So it's May of 2020, and I have to tell you, it's a tough moment for so many of us, whether you are caring for a loved one, whether you've lost a loved one, whether you have seen impacts on your career or your job, whether you're not able to recreate in the same way you were before, whether you're worried about friends and family. It's a difficult moment, and clearly this has been a difficult moment for NatureBridge. The spring is when we welcome 13,000 different kids out to their national parks to discover and learn alongside our brilliant educators. It's been nothing short of spectacularly brutal for us to not be able to welcome kids, not only not to welcome them out to their national parks, but to know that they are home and they are being educated on screens and via technology, and when so many of them have planned to have these epic adventures alongside us. It has obviously meant difficult things for NatureBridge in terms of lost revenue, but also layoffs and furloughs. It has affected us very deeply as an organization. This is the time of year when kids should be around a campfire, not a virtual campfire like you're experiencing with us now, but a real campfire, sharing stories, singing songs, doing skits, preparing in Yosemite National Park to go for a night hike under the moon to go see Half Dome, or to go explore Rodeo Beach with their friends and peers, or go through Prince William Forest Park in Virginia in the Piedmont forests, to be along Lake Crescent going for an early morning row on Lake Crescent. We so wish that that's what we were doing, but we are honored that you're here tonight. One of the other things that this pandemic has impacted is usually this is the time of year when we have an amazing gala. Fortunately, you're not parting ways with $750 to join us, but that also means not only lost revenue, but a lost opportunity to tell our story. And I want to thank so many of you who've done so much to make that gala event happen and to tell our story more broadly. So while there's so many of you, I do want to give a real shout out to Carol Yandel, who is supposed to be this year's honorary chair, to Ivy Archer Winters and Mary Poland, who've inspired this work, to Alice Warren and to Raoul Goff, who have driven it forward, and to Ananda Barron, who is the chair of this year's gala. So I'm so sorry that we were not able to put that event together, but we have put this event together, and we hope it is educational and inspirational. The other thing is that we were planning on honoring Doris Winters, one of our long-time ambassadors and champions for our work, a generous supporter and an incredible investor in our programs. We lost Doris last year, and we miss her dearly, and we thank her for all that she has inspired for so many of us. Since many of you have been to some of our events, I think you recognize that one of the most amazing parts about it is that student voice, that chance to hear from a kid who has been impacted by our program. And for those of you who have been to our gala, I think it was about 4 years ago in 2016 when we welcomed then 8th grader Selma Ruiz, and she just rocked San Francisco City Hall, and we caught up with her recently. So I'm gonna turn it to a welcome from Selma Ruiz, and then we're gonna get right into a conversation with Dr. Steve Lockhart. So I'm hoping we can get that started now.
So hi, my name is Selma Ruiz, and I was the first NatureBridge Student of the Year in 2016. So I was in 8th grade. But when I think back to my first NatureBridge trip, I was in 6th grade, so I was 13 years old, and I had never been away from my family for a long period of time. I had never gone camping. I never got to even see a forest. You know, I grew up in Southern California, so a lot of what I see is just, you know, Mediterranean climate and a lot of dry shrubs and stuff. So I had never even seen, you know, a full developed forest before. So you can imagine like my shock and my instant sense of awe when I drove in on the bus to Yosemite National Park. And it was just that initial feeling of stepping out of the bus and like feeling the cool from the trees and seeing how tall they were. It was just an experience that I never even had. So, and then NatureBridge was able to take that experience and also make it a learning experience for me as well. Because of course I had taken science classes and I had learned about our environments and I had learned about different ecosystems, but I never got to experience more than what I grew up with. So getting to learn in a classroom that was nature and getting to not only see pictures in textbooks, but being able to experience what we see in textbooks was just incredible for me because I'd never had that before. And now as in high school, I joined youth in government because during my trip to NatureBridge, we learned about the human impact that we have on our environment and the role that we play in the ecosystem and how important it is that we preserve places like Yosemite and other national parks all over the world. So I joined youth in government to be able to learn about legislation and different policies and how we can make that passion into something that's law and something that we can protect for future generations. So after youth in government and learning as much as I could about policymaking and protecting, nature in a real way, I decided to start applying to colleges. And even my college search was impacted by my trip to NatureBridge because I looked for campuses that were sustainable and made sure that they responsibly use natural resources. And that's when I decided to go to UC Santa Cruz because, again, it was another environment that I've been to, but I want to experience more of. It has redwood forests, it has beautiful beaches, and it has that connection to nature and that value of nature that has been instilled with me forever, because NatureBridge was able to give me not just learning, not just experiences, but memories that I'm going to have for the rest of my life and that I still carry around with me like through everything because I'm planning to major in environmental studies and sustainability so that I can take that passion that was instilled in me and put it into the real world and hopefully get to impact the world that I want to see with more sustainability and a bigger emphasis on protecting the natural world.
Selma Ruiz, it is fantastic to see you again. Thank you for gracing us all with your presence. I'm flashing back to 4 years ago and meeting you when you were an earnest and brilliant 8th grader in San Francisco City's Hall. Amazing the crowd with your passion for our work and your commitment to the environment. And now to see you off to college on a full ride scholarship, we couldn't be more honored and proud. And remember that Selma's story is one of a million stories of NatureBridge students and NatureBridge alumni who have been transformed by the power of our program. So thank you, Selma. And with no further ado, let me bring to the stage or to your computer at home, Dr. Steve Lockhart. Dr. Steve Lockhart, good evening. How are you?
I'm well, Phil. Good evening. How are you?
Great, thank you. Well, I just want to do a brief introduction. So Dr. Steve Lockhart is the Chief Medical Officer of Sutter Health. He's also got a distinguished resume, including serving as a Rhodes Scholar. He is a board member at REI. He is a trustee at the David and Lucille Packard Foundation. He is chair of the board of Parks California. And Steve, I'm guessing you may think you are sort of a big deal in this world, and you are, but I want to let you know that you're talking to somebody who's also a big deal. So just to put you at ease, I actually won the 4th grade science fair at my grammar school. So it was called Bugs, Reptiles, and Other Living Things. And also I was head cheerleader at my high school. So you are in good company this evening.
Thank you, Phil. We're very proud of you and all of your achievements. And so I want to acknowledge that. I want you to feel validated as we move forward this evening. And I do want to thank you and everyone else for the opportunity to speak with you this evening. Certainly, NatureBridge is an organization that is so important to me, my family, and to, I think, the greater public and the world. So it's really important and a great honor that I'm able to be here with you this evening.
Well, Steve, first things first, COVID-19 has overtaken all of our lives, and perhaps you are right at the center of it as the Chief Medical Officer serving 4 million patients across California. Can you just give us an update? Where are we at in COVID-19 in terms of flattening the curve, particularly in California, but remembering that we've got folks videoing in from all across the country?
Well, thanks for the question, Phil. You're right. Certainly in California, we are in the epicenter of all that's going on. We were one of the early recipients of patients from China. Certainly the first case was up in Washington State, which is another NatureBridge location. And we have been experiencing this surge in patients in a way that is heretofore not been seen prior to the 1918 flu pandemic. So I think what I would say about California in particular is that we have been very fortunate in a way in that we have been able to manage to, as you say, flatten the curve a bit more than we have seen in other places. A lot of this is due to the fact that we have had Governor Newsom step forward very early on to put in shelter-in-place orders, to close schools, and to close non-essential businesses. And so what that has done is that has really taken the virus's infectivity ratio, or a possibility of infection, down several notches. And where we are right now is we're at a point where we believe that we probably won't surge higher in this round of COVID infection, but we're on the downward slope towards a more low-risk environment for our population. And that this is due to what all of the public has been doing to keep us safe, which is social distancing, wearing masks, and all of that.
So, Steve, this has been such a sobering period of time, and yet there's been stories of inspiration throughout. Can you tell us a story of inspiration from your experience and from where you sit?
Well, I think there are millions of stories out there of folks on the front lines doing heroic things. Certainly we've seen that within Sutter Health as well. We've had people come in and just support people in ways that we can't imagine. Obviously, one of the great sadnesses and disappointments about this particular illness is because it's so infectious, we typically are not letting visitors into the facilities. We're not letting, non-patients and caregivers into the facilities. So often when patients are very ill or even at the end of life, it's up to the caregivers to provide that human connection. And there are many sort of brave stories of people doing that.
Steve, you really touch on this. I mean, overall, this is a human tragedy affecting so many lives. And we are, at least in the United States, 6 to 8 weeks into a great disruption of many people's lives. Look forward for us. Think about end of calendar year 2020. What's your best guess, or what is a scenario or two that you think is likely as we play through COVID-19?
Well, I think one of the important things to remember about this pandemic is, first of all, unlike many other natural disasters, usually we have a hurricane or an earthquake. They're geographically limited and they're time limited. This is now something which has affected the entire world, and it's going to affect us for a while, at least until we have a vaccine. That's really the true answer to how we can manage this disease. So between now and then, we need to think about this as not going back to what we did before, not flipping a light switch and going back to the old ways, but embracing a new normal, which is going to involve some of these social interventions like social distancing, wearing of masks, and so forth. Maybe some modifications to how we think about schools, how we think about our businesses, because otherwise we were not going to be able to control the virus. As I mentioned earlier, one of the ways that that we attack this virus is we don't have a vaccine and we don't really yet have truly effective medications to treatments, is to have the public take a role. And it's unique because this is one of the first times where people are not just coming to the healthcare organizations to be cured, but actually the treatment or the remedy is in part due to what we do as a public, as a whole. So what I would say is 3 months, 6 months from now, to anticipate that we will be still doing forms of social distancing. The question will be, how do we do this and still include social distancing parameters or the wearing of masks and so forth? So we need to think about how would we go to school with social distancing? How do we go to restaurants using social distancing? And how do we enjoy the outdoors and embrace social distancing in the same way? So those will be challenges that we'll be facing.
Steve, that was a phenomenal segue. And of course, we have many, many outdoor enthusiasts tuning in this evening. I wanted to ask you about going outside. You and I have had so many epic outdoor adventures together in our work at NatureBridge. And I was hoping you could tell all of our viewers tonight about being outside. How should we be approaching exercising, being in open spaces during this pandemic?
Well, thanks for asking that question, Phil. As you know, I am, as we all are, probably everyone who's watching this, are big outdoor enthusiasts, and the outdoors has great benefits for us from the point of view of both physical and mental health. However, I think for a lot of people, we often also think about the outdoors as a place of socialization and a place to congregate, to come together for a picnic or bring the cooler and hang around and socialize. And I think that's where we have to change our mindset, is to understand that the outdoors still has those physical and mental health benefits, but we need to be thinking about the outdoors as a place where we can go out and enjoy it safely, which means that we still need to social distance. We still can think of it as a place for mental solitude, or maybe convening only with those who are in your immediate family with whom you are living, and hence sharing the same sort of infectious profile. And so that's how we ought to be thinking about going out the outdoors, not to be afraid of it, not to avoid it, but we need to enjoy it in the safest possible way.
Steve, for a long time, you have been an outdoor enthusiast. And I think just to help our viewers get a sense of who you are, why are you, Steve Lockhart, so committed to outside access, national parks? Tell a little bit of your origin story.
Well, I was born in St. Louis in the 1950s, late 1950s, 1958. And so this was a period of segregation. It was a period of what you can't do as a young Black kid growing up. And the outdoors was an example of a place that always said, yes, you can do. There was without limitation. And it was a place where you could explore, you could develop, and really create a relationship, a long-term relationship with the outdoors. And I started off as a Boy Scout. My uncle was a troop leader. And it really has changed my life and how I view the world. And I've always said that I've always wanted to see the world from space. I wanted to be an astronaut. But in fact, I found a way to see the world, the natural world, through getting outdoors. And that's been equally gratifying. And it's a lifelong pursuit.
Tell me a little bit, particularly as we think about equity and access, not just during this pandemic, but always, who does have access to outdoor spaces to recreate, but also to reflect, and who's lacking that? And how is that showing up at a time of COVID-19?
Well, that's an interesting question, Phil, because COVID-19 has really ripped the Band-Aid off of our inequities, both our structural inequities in our society and in our healthcare system. We spoke a little earlier about the healthcare system, and we know, for example, that our African-American patients have many more problems with COVID-19, showing up sicker later, having a higher death rate, which is not unexpected given what we've already seen with inequities in our healthcare system. If we think about the outdoors, it's been a similar profile for us in the sense that having people of color being able to access, enjoy, learn from, and really experience the benefits of the natural world has been, at least in this country, problematic. That's one of the reasons why I think programs like NatureBridge are so very important. The fact that more than half of the children who participate in our programs are kids of color is very meaningful to me. It shows the promise that we may someday get to the point where outdoors is really for all. And we all know, to quote an REI slogan, that a life lived outdoors is a life well lived. And so this really is about a lifetime of engagement. And so the ability to engage children early on is super important.
Well, Steve, we have been so fortunate to work with you at NatureBridge for about 20 years, including as our NatureBridge National Board Chair. You have helped move NatureBridge from just thinking about each and every student and the impact that we can have on them and their lives, but also how we can change the conversation nationally. Talk to me a little bit about what that's been like for you.
Having NatureBridge take this larger role in terms of the landscape of not only environmental education, but education and the development of our young people is really meaningful to me. And I think that what's important as we think about the 50th anniversary of the organization's history is, what are the next 50 years like? It's incredibly important that NatureBridge be here 50 years from now. And the sustainability of the organization, our ability to move forward and carry the message into the future is what makes NatureBridge not only an enduring institution, but one of the most important institutions, in my view, that we can contribute to the nation's future. I think about all the various things that NatureBridge has gone through. We've had fires and floods and rock falls and government closures, and now we have COVID-19, all of which, except for the government closures, are part of the evolution of the natural world. So I think we have to just accept this as part of the environment in which we work, and we need to just keep working in this environment for the next 50 years.
Steve, that resilience, that message of being able to navigate these challenges is omnipresent. To say that NatureBridge and so many organizations like ours are at this existential moment would not be overstating it. I wanted to let you know, and you and I have talked about this, that NatureBridge is missing having 13,000 kids out on trail this spring for a week in Olympic National Park, in Prince William Forest Park, in the Golden Gate National Recreation Area, and of course at our birthplace, Yosemite National Park. But in the meantime, we know that we can deliver value and programs, and I think most of all, hope to students. So thank you for being part of the conversations about how we can have educators in classrooms virtually, sharing stories of investigation, sharing soundscapes of our national parks, leading inquiry-based conversations. We're looking at partnering with Summer Search and doing a summer program with high school sophomores, helping them discover and learn and really manage this pandemic individually and collectively. So through you, through everybody who's watching and listening tonight, you are all investing powerfully in our mission, our organization, our resilience, and our ability to emerge from this crisis scathed, but potentially better, potentially offering even more to our students, and certainly for everybody. The reason we are here is only being amplified right now.
I think you're right, Phil. I think you're absolutely right. And this is the process of evolution. We're learning, we're evolving as an organization. We need to make ourselves relevant to not only to the young people that we serve, but to the situation that we find ourselves in. So we will change, we will evolve, but we must continue. We must be resilient, and we must continue to gather the support that we need to keep us moving forward for the next 50 years.
Dr. Steve, thank you. Thank you for inspiring us, and thank you for that reminder of how we need to continue to evolve and adapt over the next 50 years. We know one thing, however, will never change, and that is our mission and our commitment to getting students into their national park classrooms. So while we transition to a live Q&A, can we spend 60 seconds with a reminder of the students we serve?
In nature, we find wonder.
We find connection.
We find perspective.
And we find ourselves.
In nature, we find the world's greatest classroom, a place where lessons play out before our very eyes.
A place where what we read in books, we can touch with our hands.
Nature is a place to be inspired,
A place to ask and to discover.
A place to challenge and to achieve.
and nature is the bridge between what we are taught and what we can touch, feel, and know. It is in nature, in the wonder of our shared spaces, where we light the spark, connecting young people to the world around them.
It is where we plant the seeds for a lifetime of learning and a lifelong relationship with the natural world.
Nature is our classroom. It's where we build the bridge to the promise of tomorrow.
So I was getting a lot of private texts. Yes, I do have multiple outfits on under my puffy jacket. It's very difficult. First time I've had to wear a suit in about 4 years. As we prepare to have Steve join us for live Q&A, a few things I want to do. I want to put up a poll for us because the first question I want to ask everybody is, how are you connected to NatureBridge? And of course, the number of members of the Steve Lockhart fan club are probably going up as we speak, but you can vote in multiple ways. So if you're used to using this, we've got 231 attendees. We're trying to find out who's joining us. And by the way, I was looking, people were doing a lot of private chats rather than to the whole group. We got folks from Tennessee, Maine, Idaho, Missouri, Texas, Virginia, Maryland, California, and so many places beyond that. So we are just delighted to have so many different people joining us. And you can get a sense from what's up there on the screen. Our votes are slowing down, so we can go ahead and end the poll. And you can see that we are really well split. And the Steve Lockhart, amazingly, you're not number one on the list. It's our generous donors and financial supporters, but to have teachers in the audience who we're welcoming, we are hoping to welcome once again soon out to our national park classrooms and to students and student alumni. To all of you, thank you for joining us. I wonder if we could put up another poll while Steve takes himself off of or puts himself on video. The next question I want to ask is, would you rather? You heard that intro. That was a little bit awkward with some potentially horrific photos, but would you rather be a doctor or a Rhodes Scholar? That's fine. Head cheerleader maybe, fourth grade science fair winner. Steve, I'm so sorry to share the news with you that it looks like people would most like to be. Let's go ahead and end that poll in 5, 4, 3, 2, 1. Most people want to be a NatureBridge student. And I think you and I both agree with that. So Steve, thank you. The question I want to ask to start, and then I'm going to go through the questions that other people are asking. The question I asked earlier, where are you spending some time outdoors during the time of lockdown and pandemic? Just give us a sense of where you live and how you're getting outside.
Well, first of all, good evening, everyone. And I would say that I live right near Lake Merritt. For those who aren't familiar, it's in Oakland. It's a beautiful urban lake. It's a bird sanctuary, and I just go out my door and walk 3.5 miles around the lake, or sometimes I lift my knees a little bit quicker and call it a jog, and it's been really beautiful. So that's what I've been doing locally. Of course, I love getting out to places like Yosemite and other national parks on a regular basis. It's very much a family affair for us to do that, but during the time of this sort of shelter in place, I have been able to get out to Lake Merritt, and I look at it out of my window. So it's been very, very good for us to be here.
Yeah, we'll come back to a few of the questions that are queued up on recreating safely outdoors, but I'm going to ask a question from Tom Kiernan from Washington, D.C., so stay with me on this one. Steve,
this could be a tough one if it's from Tom Kiernan.
It is. It's all about wind energy, and you need to know.
He is interrogated the best,
Steve, the world is appropriately consumed with the societal challenges from COVID. How do you think we'll be able to bring attention back to connecting kids to the out of doors and re-engaging with climate advocacy?
That's a great question. And actually, what's interesting to me is how this is sort of a virtuous cycle. If you think about COVID, the lessons we learned from COVID, we learned about the structural inequities and inequalities in our healthcare system and also in our society. But we also find that the Earth is breathing better. In the 50th anniversary of Earth Day this year, the skies not only were clear in Beijing, but they were clear here in Oakland, where I could see out to the actual bay past the estuary. So there's something to be learned there around our impact on the planet, and putting that all together as a common message, around humanity, around our impact on the planet and how we are part of the natural world. And we must both be aware of that in terms of things that make us ill, things that keep us healthy. But our health and the planet's health, as E.O. Wilson says, they're inextricably linked through this notion of biophilia. And so I think those are the lessons that we need to continue to teach and reinforce. And it'll become clear that our policy needs to not only focus on, public health is planetary health to a certain extent.
Great, and I'm gonna, for everybody, down at the bottom of the screen is that Q&A button, and you can use that to either check out the questions that others are asking and give a thumbs up if you think it's a question we should be asking, or type your own. So I'm gonna go to the next question that a lot of people are liking. NatureBridge serves young people. There's a lot of news coming out of New York about the impact of COVID-19 on young people. I think early on we thought it really wasn't affecting and impacting young people. We've got parents, we maybe even have students and kids on this call. What advice do you have, or what's your insight in terms of how COVID-19 is impacting youth?
Well, I think there are a couple of things there. There are a couple of sort of medical, physical health issues. I think just recently, and maybe even be in the news today, there's this whole new post-viral syndrome that folks are talking about, similar to Kawasaki's disease, which is a vasculitis, and it comes 4 to 6 weeks after even a subclinical or asymptomatic COVID infection. It's rare, it's something to be aware of in kids. It's not, I think, the largest impact that we're seeing on our kids. The largest impact on our children is the fact that we need to continue to get them outdoors. And we need to get them to socialize and grow in a way that is safe. Again, it's very much like what I was speaking to during the earlier conversation, that we need to continue those things, but just in a safe way, with physical distancing and wearing a mask. Well, we need to get our kids outside, and we need to figure out a way to do that safely. And so it's not a choice, it's a both and.
Well, and Steve, that brings up, I mean, you're an economist and a medical doctor. How, maybe wearing both of those hats, real versus perceived risks on COVID-19? What's your feedback there?
Well, if I understand your question, the risk really from a public health perspective is this is a very serious disease that can cause illness and death. And the most important thing to know about it is that even if it doesn't make you incredibly sick, you can carry it and give it to someone who gives it to someone who gets incredibly sick. So there are some real dangers to having unchecked COVID infection going through our communities. But again, there are ways that there's this false choice between we have to be entirely shut down or we have to be entirely open. I think what we need to do is have responsible management of our social interventions to measure and monitor our, the impact, and to do our surveillance, contact tracing, and isolation. And I think that those are the things that we need to focus on. Unfortunately, I don't believe that we're quite to the point where that is being effectively done. Certainly not across the country, and in many places we're inadequately prepared for that.
Steve, you addressed this a little bit earlier, but it is a good question that I want to come back to, which is, are you expecting another surge come late summer, fall? We asked you to map out that trajectory over the next 6 to 18 months. Give us your sense on what you're learning now.
Well, I think clearly the answer, and actually Dr. Fauci mentioned this in his Senate testimony as well, is that the notion that we'll have some kind of vaccine in 3 or 6 months is a bridge too far. It's just not going to happen. So as we relax some of these restrictions, the virus is still there, and the more relaxed your restrictions are, the more cases you'll have. Of course, the more consequential impact it will have. So if we do that, we will see the numbers of cases go up. The real question is whether it's going to be a really steep sort of catastrophic curve like we saw in New York. Is it going to be sort of a smoldering kind of rise, low rise, or is it going to be this sort of sinusoidal wave that comes and goes? And I think it could be either of those options, but certainly I'm hoping that the most likely will be this sort of sinusoidal where it'll get a little bit worse and then we'll clamp down, we'll get a little bit better, and we'll come and go. But that also means we have to have the political resolve when it does begin to get worse to put in those restrictions and social interventions, which are not going to be, they're becoming increasingly less popular and acceptable to people. But I think if we have the resolve to do that, we can keep this hopefully under some modicum of control.
Yeah. Again, for folks, if you are able to go to the Q&A button in the bottom, you can ask questions or you can upvote questions you think are great in the chat room. Be sure when you send the chat, you're sending it to all panelists and all attendees so everybody can see it. So I'm going to try and merge what's coming in the chat and what's coming via the Q&A. So a friend from Washington, D.C. writes, in conversation with social justice advocates in my local community, I'm having some difficulty getting them to see access to the outdoors for all as an issue that matters right now. Do you have any advice or strategies to recommend?
Well, I think the way to frame that is that we're seeing the same issues with COVID-19. So there's mental and physical health, and I'd say access to the outdoors. It's both a justice and equity issue in terms of simply outdoor access, but also in terms of the mental health benefits and the physical health benefits of being outdoors as well. We see that the way in which COVID-19 has disproportionately impacted communities of color, in particular African Americans, and in some communities Latinos, is just evidence of the lack of equity there as well. So I think it's part of the same conversation. It's part of the same continuum. And I'm hoping that because this is such a large disruptor and it's such a huge, pay attention moment, that we hopefully will pay attention and we'll address both, the inequities that have existed in terms of access to healthcare and so on, but also these inequities that have existed in terms of access to the outdoors, which is a natural part of one's health profile when we think about how we live our lives, not just how we interact with the healthcare system, but how we live our lives overall. Both are very, very important.
Yeah. Steve, a great question came through it, and this is it. In light of the access to the outdoors as a signature component of NatureBridge, how can NatureBridge be a model for many school programs as we face the new paradigm?
Well, that's a good question, Phil. And I'm not sure in fact, I know I don't have all the answers, but I do know that we have the most outstanding and unique and wonderful component of NatureBridge are our educators. Mm-hmm. And they are really what makes NatureBridge special. And we have almost 50 years of educators coming in and literally working magic with millions of kids in creative and innovative ways, which puts us at the forefront of environmental science education. So I'm confident that there are ways in which these very, very talented young people can help us figure out ways that we can engage kids in the new paradigm. How do we do this? Maybe partially through virtual methodologies and partially through in-person methodologies. I think we're also learning that whereas some people, I think, initially may have thought of the outdoors as a place of danger for virus and infection, that if it's done properly, that actually can be a place that is much safer if it's done properly. So there may be ways in which we can continue to engage kids differently than we normally do, not having them quite so close together or maybe so many of them in one place. but there are ways that we can engage them both with the outdoors. And also I think that this virtual paradigm, this may be the chance for us to take a hard look at how we engage kids both in the school programs and then when they're with NatureBridge. So I don't have the answers, but they're out there, and I know that NatureBridge will figure it out.
Well, so Steve, I'm going to ask two more questions. One will amplify the question that I just asked, but you're absolutely right. That's what we are thinking about and wrestling with. You're going to come to the fall and schools are going to be open 2 days a week. They're going to open 5 days a week, but with shifts of classes, they're only going to have 8 to 10 in a classroom. What are the other kids going to do? So we are trying to figure out how can we help answer that call, answer that need, because it's not just the need for the kids, which is why we exist, but there is a desperate need from the parents to get the kids out of their house so that they're not yelling at them when they're trying to do work, so the kids can be free to discover and explore. I mean, this is their teacher right now for all too many kids, and we need them out breathing fresh air, exploring and discovering wherever possible. So we're working creatively on that. So I'm going to ask a question from our friend Linda Brownstein in Park City, Utah. Schools don't know what will happen even in September. So I'm echoing Dr. Steve sharing that we need treatment and a vaccine to get to a safe place. What can NatureBridge do to create a new normal? If schools can't come to our campuses in the fall, what can we do? Can kids come to create our new normal if kids come to our campus? What resources are needed to make this happen? So I don't expect you to have the answer, but any thoughts or feedback on that? And then I'm going to ask you about that great picture that you had behind you in the earlier interview.
Well, my first comment is hello, Linda and Neil, and thank you for joining this evening. It's wonderful to hear from you. Yeah, I really don't have the answers, but I do know that there are ways in which we can do some kind of hybrid melding of the in-person real experience with the virtual experience. Perhaps we can, and one of our big components of NatureBridge for many, many years has been, well, two things really. One is the support that we've shown and given to teachers. You know, there have been a lot of sort of teacher development opportunities that NatureBridge has provided. And so really helping support the teachers and how they can connect kids with the environment more effectively during this time can be something that's very, very important. And of course, you know, I think those are some very, very important opportunities. And then we must remember that for a number of our students in our schools, the NatureBridge program is the science program.
Right.
So what that means is that we have to recognize the pivotal role we play in providing science for these kids. I mean, just as we have children who need the free and reduced lunch, you know, is the only meal that they may get. In the same way here, we are often, you know, only science that these kids get. So I think there are ways we can support the in-school environment and still connect them to the out-of-school environment. And they may not, you know, again, we may not have the same numbers of groups of kids together for the same period of time. And who knows, with the schools just coming back and trying to reorganize and figure out themselves what their curriculum and program looks like, we may not be, you know, at the forefront of what they're trying to do initially, but I think we can show that we add value by really supporting the teachers as well as the students.
So there, by the way, there's so many amazing questions in here, everything from where do you go to get real news versus fake news on COVID-19. Lots of people asking so many great questions. So if Steve, as I go to the next part, and I'm gonna ask you one more question, you wanted to try and type answers into that, that would be great, but just know that there's so many great questions there. One thing I will say, I see a San Francisco State University biology professor and parent who says, hallelujah to that. Get these kids out of my house and into nature when they are not in school. So the challenge is in front of us, and we are trying to meet that challenge as best we can with our brilliant educators. And, you know, again, reflecting this is a brutally difficult time, and we're gonna work best when we get through this together. Steve, when I was talking to you earlier, and then this will get to our closing, there was a photo behind you over your shoulder. It was actually of this. Thank you for calling this up. Can you tell us a little bit about this photo and why it was up on your wall?
Sure. So this photo is called Earthrise, and Earthrise was taken by Bill Anders, who was an Apollo 8 astronaut, along with Frank Borman and Jim Lovell, who in 1968 circled the Earth around Christmas time. And it was Bill that took that photo. That's been the most iconic photo of the 20th century. And when he took that photo, and they realized that this was a point at which they saw the Earth's fragility and realized the accountability that we have as its inhabitants to care for the planet, both the planet, and we need to care for each other, its inhabitants. And that's actually kind of created for me an ethical or moral, strategy for, living my life in some ways around both caring for people as a physician and then caring for the planet as an environmentalist. So after 1968, Bill came back, and that photo went around the world, and it really started the environmental movement, in my opinion. 1971, Bill found a way to make that take action on that here on Earth by becoming a founding board member of NatureBridge, which at the time was Yosemite Institute. So he was actually one of the founding members of Yosemite Institute. And then a while later, his wife, Valerie, who's absolutely fantastic and wonderful. We all know and love Valerie as well. She was responsible for leading the charge to help open up our Olympic campus, which has been, in operation for, decades now. So between the two of them, they've really been some of the most pivotal leadership in NatureBridge history. And so that photograph, which has had a 50-year anniversary a couple of years ago, Earth Day has had its 50th anniversary this year. And of course, NatureBridge is having its 50th anniversary next year. And the Anders have made a commitment to making sure that NatureBridge is around for the next 50 years by making a generous donation to our Be the Bridge campaign. I believe it's a $100,000 gift that was given to encourage all the rest of us to step up and make our commitments as well. And Karen and I have done that with a similar gift of $100,000, of which $70,000 will go to the Be the Bridge. And so, and I know many of the people on the call have as well. We saw that the donor list was, everyone was, a lot of people here have been donors. So very grateful for that. But I think the point is that this is a time that is pivotal for the organization, and floods come and go, rock falls come and go, even pandemics, maybe only every 100 years, but they come and go, and we need NatureBridge to be here for the duration. So,
Steve, I am just in awe and amazed, and I think we just updated the Be the Bridge campaign, and with the Anders' incredible contribution and Team Earthrise with you and Karen and Anna answering the call, I think we're over $960,000 raised just with this Be the Bridge campaign. And so many people on this video have already donated. And I want to thank you from the bottom of my heart for believing in us, for believing in our mission, for knowing how valuable it is for us to offer these adventures for discovery and learning in their national parks. These kids need to get into their national parks, and you're helping make that happen. So thank you to you. If you stick around a little bit longer, on the bottom of the screen, you'll see the scrolling list of all the names of the incredible people who have answered this call. If you were inspired tonight, if you haven't had an opportunity to donate, we welcome you to do that. In the chat window, you're going to see the URL to go there, which is naturebridge.org/give. You can also just type into the chat window for everybody to see, or just for the panelists, and let us know if you're interested in donating and how much, and we'll make sure to follow up with you respectfully. But thank you. Thanks to you, Stephen, for all of your incredible leadership for 20+ years of carrying us on your back sometimes. Thanks to all the volunteers and board members and donors and teachers and educators and staff and former staff and students who are on this call. We're honored to have you all. And Steve, from one Rhodes Scholar to from one head cheerleader to a Rhodes Scholar, I thank you for being such a champion. And to all of you, thanks for joining us tonight. It seems like people are enjoying this. We might do it again. I got a yes from an astronaut, and I got a yes from Yosemite National Park superintendent for conversation. So we may do something like this again, and we'll invite you all to join us. But thank you to all of you. We'll stay on for a little bit. And Steve, again, if in the Q&A you've got any things that you want to respond to, we'll just keep the mic on if you want to say something to any of the questions that you're seeing there.
Well, thanks, Phil. I feel like I've been roasted a little bit, and I'm going to go roast some marshmallows here in a minute myself. But all right, so I'll pull up the Q&A. Oh, these are the tough questions, Phil. These are hard. Okay. All right. So you'd like me to just type the answers, so I'm gonna.
You can actually say them out loud. I mean, as long as people aren't tuning out, that may be the faster way to do it.
Okay. Well. Wow, this is a difficult one, but so I'm going to mention it because it's a challenging one. Given what you see in California, how long before we can welcome students back to NatureBridge campuses, and how can we assure their safety? So I think it's interesting because that's the same question that we're facing in our hospitals and clinics, right? Is how do we open up? And people are afraid. They're afraid to come back because they think, well, is it really safe? I think that what we're going to have to do, I think the most prudent way to approach this is with the phased approach. Try small things, test of change, and then get bigger and bigger. So I think obviously the social distancing will be an issue. So we would have to figure out how we house kids in a way in which they're not, on top of each other, how we feed them. I think, ironically, some of the outdoor activity pieces are going to be some of the easiest to manage because, we have the outdoors. So there is space. Typically, even when we're on trail, some of the wilderness trails, the numbers are limited by virtue of the fact that it's part of wilderness. So I think those will be easier to manage. I think the housing and the dining and some of those things that come with the residential program will be more challenging, but they're the same challenges that our universities are facing. I think there will be some answers coming out very soon. So I'm hoping, if not the fall, perhaps certainly later in the fall or the beginning of the next year. I think the bigger thing will be when the schools are feeling comfortable and when the schools actually have their programs together enough that they feel that they can bring a group to NatureBridge. That'll be the limiting factor.
Steve, while you're looking at the next question, I'll do one bit of reminder hospitality. Many of you have joined us for the first time ever. You didn't even know about NatureBridge. You were invited by a friend. So hopefully you got a good sense of who NatureBridge is tonight and why we're fighting so hard to get back. But thank you, Nancy Dyer, for pointing that out. Welcome to so many of you who may have never heard of NatureBridge before. Do you see another good question in there,
another
Steve?
One. This is from Kristen Robrock. You stressed how important the outdoors are to our well-being. How do you feel about the large-scale park and beach closures? Is isolating us from nature going to help us survive this pandemic? So actually, it's very interesting. I was on speaking about the opening of beaches in Ventura County 2 or 3 weeks ago. And this was at a period of time when Los Angeles County was surging. So I think the answer is it depends how people are going to use them. The problem is that when those beaches were opened, people flocked from all over and they became the same crowded beaches with the cooler in the middle, 10 people around it, people having picnics and barbecues and not social distancing. So again, as I sort of alluded to in earlier comments, I think provided we can maintain the discipline of thinking about the outdoors as a place to go to have more either solitary or small group experiences rather than large group experiences, we can be successful. So it's not the closure of the beaches or the keeping the people off the beaches that was the goal or the issue. It was that you had Ventura County right next to LA County, lots of COVID spikes, and you open a beach, everybody's coming, and then it just keeps the pandemic going. So I think it's really how we use the outdoors rather than whether it needs to be closed. It doesn't need to be closed, but it needs to be used responsibly.
Yeah. So Steve, by the way, we're at 6:59. We're going to do one more question, Steve. And by the way, as Steve looks through these, he's looking for, Phil Pillsbury, you've asked a great question. We're seeing some wonderful things from Julie Parrish and Robert Holmes, Mary Kiley. So many great questions here, but you're going to have to pick one to lead us out with.
Do you want to pick one?
Well, I'm going to ask, let me point not to necessarily a question that I'm attracted to because I haven't read the question, but I see Lori Peters here. And Lori is Selma Ruiz's introduction to NatureBridge. She was the one who helped Selma go to Santa Monica Mountains, go to Yosemite, go to Olympic National Park. And she is a school administrator. So Lori asks, if you had or have a children in middle or high school, what are some basic things you would expect to happen at the school in order for you to have greater confidence in sending your child? So from the parental perspective, what are a few sort of basic must-haves?
So if you're a parent, so if I understand the question, it's like, if you're a parent, before I send my kid back to school, we're talking about middle school, high school.
Yep.
What do I think I need to have in place?
Yep.
Well, a couple of things. One is, there are some very simple things that make a huge difference. Hand hygiene, as much as it seems obvious, washing hands, and people focus on hand sanitizer, but just hand washing itself. And by the way, if you wash your hands, it should go for 20 seconds. You can sing the ABC song or happy birthday. That's about how long it is. Lather up and really scrub. And it's a very simple thing. So having the kids, be very aware of that. I think when you get to high school, they're going to be very much more self-motivated, but really having these standardized times that kids will wash their hands before they eat, no sharing of food, 6 feet apart, wearing of masks, all of those sorts of things really can make it safer. Now, it's not going to be as safe as sheltering in place or not, because the virus needs a human to transfer from one to the other, right? And obviously there are surfaces you can get it off of as well, but you need, if you're with more than 6 feet away, that's going to reduce the likelihood. If you're wearing a mask, that will keep the viral load closer to the person if they are infected. So I think the 6 feet physical distancing, the wearing of masks, the frequent and fanatical hand washing, and then the other thing is kids don't get to come to school sick, nor do the teachers. I think we've all seen a lot of times where people are coming to school. Your kids, I don't feel so good. Go to school. Because you're not that sick. Well, if you're at all sick, you should stay home. The other thing, and this is my last comment on that, is get the flu shot. We only have about 20-25% of people get the flu shot. And you've got to remember that come the fall, particularly the late fall, it'll be flu season again. And that's when you're going to have people getting these flu-like symptoms. And it would sure be nice to know that whether it's COVID or the flu. So if you've got all these people who haven't had their flu shot and they're getting sick, then you have issues around what is what, and you're then packing the physician's offices or the emergency rooms with unnecessarily. So staying healthy by doing all the preventive things like getting the flu shots and vaccinating your kids is another thing. We've seen the numbers of just routine pediatric vaccinations drop off. That's not a good thing. So all of those things are things that you can do, and I think that and the other piece is, I think to make sure that you're in a sort of low prevalence COVID environment. In other words, where the curve has begun to come down. I think you can feel relatively safe at that point, relatively.
Steve, I'm amazed by you always. I'm grateful to you always, as are so many people. You can just see it through the chat window. You can feel it through the screen. Thank you, Steve, for being here, for being our featured guest on our first Campfire chat. I want to thank everybody for Zooming in tonight, whether you're Randy Fisher, whether you're Kim Orbuck, whether you're Marsha Hodges from East Coast to West Coast. I saw somebody from Canada, Andrew Thompson, joining us. So thank you very much. And Corey and Annie, if you want to roll our end screen for any donors who want to see their name on the list. And thank you for supporting us through Be the Bridge. Everybody take care, have a pleasant evening, and be safe.
Thank you. Good night.